Heart disease is often called a silent killer for a very specific reason. It rarely causes pain until it's almost too late. Most people assume that if they aren't feeling chest pain, their heart is fine. But clinical reality tells a different story. Atherosclerosis, the buildup of fats and cholesterol on your artery walls, is a process that takes decades. By the time you feel a squeeze in your chest, your arteries might already be 70% blocked. Today, we are going beyond the obvious. We are looking at the 5 subtle, non-cardiac signs that your body uses to signal a plumbing problem in your circulatory system. Understanding these whispers could be the difference between a routine checkup and a medical emergency. When we think of back pain, we think of muscle strains or herniated discs, but your spine requires a massive, constant supply of oxygenated blood to stay healthy. The lumbar arteries, which branch off the abdominal aorta, are responsible for nourishing the discs between your vertebrae. Research published in the journal Spine has shown that individuals with chronic back pain are more likely to have advanced atherosclerosis in these specific arteries. When the blood flow is restricted, the discs begin to degenerate and lose their cushioning ability. This leads to chronic, nagging pain that physical therapy alone might not fix. If you have persistent lower back pain that doesn't seem to have a structural cause, it's not just a back issue, it could be a vascular warning sign. We call this discogenic pain caused by ischemia or lack of blood flow. Does your calf muscle cramp up after walking just 1 block, only to vanish the moment you sit down? In medicine, this is called intermittent claudication. It's the leg version of angina. Just as your heart needs more blood when you exercise, so do your leg muscles. If the arteries in your legs, the femoral or popliteal arteries, are narrowed by plaque, they cannot deliver enough oxygen during the stress of walking. This leads to a buildup of lactic acid, causing that painful cramp. The danger here isn't just in your legs. Peripheral artery disease (PAD) is a systemic condition. If your leg arteries are narrowed, there is a very high statistical probability that your coronary arteries are in a similar state. This is often the first physical symptom that tells a doctor your entire vascular highway needs an inspection. This is a sensitive topic, but from a clinical perspective, it is one of the most accurate predictors of heart disease in men. The artery size hypothesis explains why. The arteries supplying blood for an erection are significantly smaller than the arteries in your heart. Therefore, they show signs of blockage much earlier, often 3 to 5 years before a heart attack occurs. Modern cardiology now treats erectile dysfunction not just as a quality of life issue, but as a primary cardiovascular risk factor. If the small pipes are struggling, the big pipes are likely next. If you are experiencing this, a trip to a cardiologist for a stress test or a calcium score might be more important than a prescription for lifestyle meds. It's an early window of opportunity to reverse the damage through diet and therapy. It sounds like a myth, but it's actually in the medical textbooks. A diagonal crease that runs at a 45-degree angle across the earlobe is known as Frank's sign. It was named after Dr. Sanders T. Frank, who first observed it in patients with heart disease, while the exact biological link is still being researched. The prevailing theory is that poor circulation causes the breakdown of elastic fibers in the earlobe, creating the crease. Dozens of studies, including one published in the British Medical Journal, have correlated this physical trait with an increased risk of coronary artery disease. It is a subtle, external indicator that your internal microcirculation might be failing. It's worth a look in the mirror, not for diagnosis, but as a prompt for a professional screening. We often dismiss fatigue as stress or getting older, but there is a specific type of exhaustion that signals a struggling heart. If you find yourself gasping for air after climbing a flight of stairs that you used to breeze through, pay attention. When plaque narrows your arteries, your heart has to work twice as hard to push blood through. This puts immense pressure on the heart muscle and leads to fluid buildup in the lungs, making you feel short of breath. This isn't just being out of shape, it's an efficiency problem in your pump. If your stamina has dropped significantly in a short period, your heart is telling you that its oxygen demand is outstripping its supply. This is a red tier warning sign that requires immediate medical consultation. The good news is that your vascular system is resilient through a combination of a Mediterranean-style diet, consistent zone to exercise, and medical management. Plaque progression can be slowed or even stabilized. Don't wait for the big event. If you recognize even one of these silent signs, talk to your doctor about a lipid panel and a CT calcium score. Knowledge is power, and early detection is your best defense. If this deep dive into cardiovascular health was helpful, Please like the video and subscribe. We believe that everyone deserves access to evidence-based health information. Take care of your heart, and it will take care of you.